The title slide, please. Good morning, everyone. Thank you for joining in. We'll be starting very shortly. I request my colleague Bhavesh to please put the yes. Thank you. We will just let all the attendees come in and then we will start our session. Thank you everyone for joining us. Good morning to everyone. We are going to be starting in 2 minutes from now. We're just allowing all the attendees to join in. All right, I think it's good time to start now. So once again, good morning, everyone. Thank you so much for joining us today for the Merck Foundation Health Media Training. Today, we have journalists from 3 countries, that is Malawi, Namibia, and Botswana. First and foremost, I would like to thank our partners for all the support that they have provided us for today's training. For Malawi, our partner is Her Excellency Mrs. Monica Chakwera, the First Lady of the Republic of Malawi and the Ambassador of Merck Foundation More Than a Mother campaign, together with Media Council of Malawi. For Botswana, Botswana Editors Forum and the Media Institute of Southern Africa. Thank you so much to all our partners. Merck Foundation Health Media Training is a part of Merck Foundation More Than a Mother community awareness program. As you all know already, that it is being organized to emphasize the important role that you guys, media, can play to influence our communities and our society to create a cultural shift with the aim to address the sensitive and critical social and health issues. We would like to begin by showing you a small video through which we will show you how the establishment of More Than a Mother happened, what inspired Merck Foundation to begin this campaign, and how the First Ladies of Africa collaborate closely with Merck Foundation to support and empower women living with infertility through access to health, information, and change of mindset. Can we play the video, please?
Jacqueline Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband, for failing to conceive, even though he was the one with a fertility problem.
Mandi ndio nilisikia akigonga mlango akiniambia Jackie nifungulie. Niliachana na chakula nilikuwa nakula, nikaamka nikaenda nikamfungulia. Kitambo nimfungulie ndio alikata hii mkono. Nikaanguka hapo chini na akanifuruta nikaenda nikaanguka huko chini. Kitambo nianguka huko chini alikuwa ananikata kichwa na mikono na uso na akanidunga hapa na kisu na hiyo panga alikuwa nayo. Aliponichapa nilimuuliza, kwa nini ngila unanichapa? Utaniua peke yako. Akanyamaza akaniambia, leo ndio siku yako ya kuongea, hautaongea tena maishani.
Merck Foundation came to the aid of Jacqueline through the Merck More Than a Mother campaign. She was provided with a new home and a supermarket to enable her to earn a steady income and become independent. Like Jacqueline, there are many other women that suffer from infertility stigma. Merck Foundation works closely with partners to empower them to be heroines of More Than a Mother movement.
So before we proceed further, I would like to share with you all about the 8 important awards that we have for the best film, best media, best fashion designer, and best song. I would want my colleague to please showcase on the screen the 2 media awards that we have under the 2 categories. The first one being More Than a Mother. Yes. So we have More Than a Mother Africa Media Recognition Awards for all the African countries, and particularly for the Southern African countries, to raise awareness about any one or all of the following topics, which include breaking infertility stigma, supporting girl education, women empowerment, ending child marriage, uh, ending FGM, stopping GBV. So you all are invited to write stories on these topics and share your entries for us for the awards, and you might win. There is another set of awards that we have for all of you, which is media, which is our lifestyle awards. So the topic is to create awareness about diabetes, hypertension, and emphasizing on the importance of promoting a healthy lifestyle. So these are the 2 media awards that we have, and now you see on your screen 6 more awards that we have: the 2 fashion awards, the 2 film awards, and the 2 song awards. I request you all to please share with your communities, to your people, so that more and more people and artists from your own countries can apply and share their entries and be the winners and be the change maker, be the health champions in their society. Before I call my first speaker, I would request my team to please play a small video, which is like a promo of Our Africa by Merck Foundation TV program, which is a program that has been conceptualized, produced, directed, and co-hosted by the CEO of Merck Foundation, Senator Dr. Rasha Kellege. I would like to share with you all that Senator Dr. Rasha Kellege has recently been recognized as one of the most influential African women of 2024, and this is for the 6th year in a row. The program, Our Africa, features African fashion designers, singers, and prominent experts from different domains to raise, and they all are coming together to raise awareness about key issues in Africa. The show has been broadcast on many countries on prime TV stations, and it is currently live on NBC in Namibia. Can we have the promo, please? Bhavish, can we please have the promo?
Senator Dr. Rasha Kellege and creator of Our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma, yes to girls' education. We want to stop gender-based violence, full stop. Number of child marriage will double by 2050.
Thank you so much. You all are welcome to share the show, which is available on our social media channels, to share with your own audience on your TV stations. If you would like to have this on your TV show, please, you can contact me on personal message. Okay, now it is time for us to call the first medical speaker for our session. She is Dr. Martha Chimangeni Aliya, consultant obstetrician and gynecologist, head of department at the University of Kamuzu of Health Sciences at Malawi. I would also like to mention that she's also the Merck Foundation alumni. Welcome, Dr. Martha. Please enlighten us today about infertility prevention, the link between infertility and infectious diseases, and also the very important topic of male infertility. Over to you, Dr. Martha, please. Also, I would like to mention, if you have any questions during Dr. Martha's session, you are welcome to drop your questions in the Q&A section below. She will be answering those questions after her session is over, or we will be taking these questions towards the end of the session. Over to you, Dr. Martha.
Thank you very much, and thank you for that kind introduction. As already said, I'm Dr. Martha Masamba. I'll be taking you through this morning a short presentation looking at infertility and focusing on how we can prevent this, and also looking at the link between infertility and infectious diseases. And knowing that infertility is a shared responsibility between men and women, we will also talk about male infertility. So Merck Foundation, More Than a Mother program, is really about making sure that we break the stigma that is surrounded, that surrounds infertility, more especially in Africa. We may all be aware that in Africa, where there's infertility, where a couple is struggling to conceive, this can have quite severe consequences socially and culturally. So the importance of this awareness and prevention training. So just an outline of what we are going to look at: infertility prevention and the link between infertility and infectious diseases, and also looking at male infertility. These are our hashtag handles. Men too, say no to infertility stigma, more than a mother, and more than a father. So it's important to know that despite having infertility, human beings should be treated as human beings, whether they are a woman or a man. The fact that they don't have children should not make them be less important than those that have children. So let's always remember, and I'll keep referring to this quite a number of times during my presentation, that a woman is more than a mother and a man is more than a father. So just a little bit of a background. In Africa, there are a number of traditions, cultural and religious practices, which when combined with low resource environments in which we live, are linked with a higher levels of preventable causes of infertility, both in men and in women. And some of these factors that contribute to these high rates of infertility include, but these are not limited to these that have been listed here: poor nutrition, untreated sexually transmitted diseases, unsafe abortions, consequences of infections that have been caused by practices, unsafe practices such as female genital mutilation, and also exposure to smoking and leaded petrol and other environmental pollutants. So as we go through the presentation, I will be elaborating more on these factors. And in sub-Saharan Africa, and we know that infection is the cause of infertility in up to 85% of women that are seeking fertility care. This is in contrast to 33% worldwide. So we can see that the link between infection and infertility is very important, specifically in sub-Saharan Africa. As we go along, I will elaborate more on how this link comes about and why we need to have regular checkups for both men and women. And just to emphasize that women should be treated as human beings, not just as mothers. So they are more than a mother. So we know as part of the infections, as I said, it does result into infertility in women, and this is how it comes about. When you've got infections, particularly with the bacteria chlamydia and gonorrhea, these infections can then result into pelvic inflammatory disease. So pelvic inflammatory disease, it's a condition in which you've got the infection causing damage to the uterus, to the fallopian tubes, and the ovaries, basically the reproductive organs of a woman. And so if these organs are damaged, then that can result into infertility. Unfortunately, as opposed to maybe many other bacterial infections, in women, these sexually transmitted diseases caused by chlamydia and gonorrhea, mostly they are without any symptoms. And so the person that's got infected doesn't feel sick. So because of this, it kind of like becomes a silent infection, and very likely that it will remain untreated. So if this infection is not treated, that's where then the damage comes in, what I said, what I described about the pelvic inflammatory disease. Besides the chlamydia and gonorrhea, another important sexually transmitted disease is HIV. We all know about HIV, I'm sure by now, and we know what its main impact is. We know it reduces someone's immunity, and so this results into illnesses like TB, bacterial infections in all sorts of places. And that then brings us back to the issue of pelvic inflammatory disease, which then, if both of these, the chlamydia, gonorrhea, and HIV, they are both sexually transmitted infections. So if you get the chlamydia and gonorrhea, your risk of getting HIV is also increased. But then having both is even worse, because then you've got the issues with systemic illness, stress that comes along with knowing about the HIV status, and then the resultant weight loss, that as we go along, you will learn that this in itself can also contribute to infertility. So some of the ways in which HIV affects their ability to conceive or the ability to reproduce is its effect on the production of hormones that are required for someone to get pregnant. And this can result into irregular menstruation and so impaired ovulation. These are all important steps and important functions for one to be able to conceive. So we need to know that infertility affects men and women equally. And having said and having talked about the sexually transmitted infections, it is important that men and women are aware that practicing safe sex is not only important for the prevention of sexually transmitted diseases, but it is also important for the prevention of infertility. This is more important for those young men and women, yeah, so adolescents, because they are more prone to contract the sexually transmitted infections. And if they are very unlikely to seek treatment. And so as we talked about the silent infections, chances are that
There seems to be a network challenge. We'll just wait for Dr. Martha. Dr. Martha?
Dr. Martha, unmuted.
Okay, sorry about that.
No problem. Dr. Martha, before proceeding further, can we stop your video for a short while so that, because it's eating the bandwidth?
All right.
Yes, thank you.
Yeah, so the importance of practicing safe sex should be emphasized for both men and women, both young and old, because of the impact it has on fertility, as we have already explained. Can I be allowed to move the slides? It seems I'm not able to move the slide.
Sure, we'll give you the control again. Bhavesh, can you please try giving the control?
Given the control.
Is it okay for you, Dr. Martha, now?
Yes, now it's okay.
Perfect, perfect. You can continue.
Yeah. Yeah, so now having said that, we know that there are strategies that can be put in place to help women become pregnant. And this is really looking at increasing the chances of one becoming pregnant. So exercise has been shown to help in improving one's fertility, but this should be done moderately. So if the exercise is too intense, then it can result into infrequent. It basically interferes with the hormone systems, and so infrequent or absent menses can come about, and therefore this makes it difficult for one to conceive. So the exercise should be moderate. The diet is important. Eating a balanced diet and ensuring that a healthy weight is maintained. So both extremes are not good. If you are underweight, there are issues with hormonal function. If you are overweight, the same things happen. So maintaining a healthy weight is very important. So besides the exercise, you also need to make sure that one is eating a balanced diet. Smoking is known to have detrimental effects both on the fertility and on general health, but also on the unborn baby. So if someone is trying to conceive, it is advisable that they stop smoking. The same thing happens with alcohol and any other illicit substances. These all result into problems. Either they can interfere with the ability to conceive, but also during pregnancy, this can cause a lot of complications to the unborn baby. Caffeine should be taken in moderation, but for one that is trying to get pregnant, this should be limited. And usually the guidance is not more than 1 cup of coffee in a day. That is considered a safe limit. But where it is possible, completely stopping taking caffeine whilst you're trying to get pregnant is the ideal. Industrial and environmental toxins are also known to contribute to problems with conception, and also they can result into problems and complications to the unborn baby once women get pregnant. So things like pesticides and heavy metals found in some fish, these should be avoided. Now, having talked about infertility in men, we mentioned that fertility is a responsibility for both men and women. And so we move on to talk about male infertility. So we know if you ask anyone, they are going to agree that men are core to the reproduction process. There is no baby that comes about without a man. However, when it comes to infertility, it is neglected that men are actually also as important to this problem. They share equally the problem with women rather. So we want to work towards creating a cultural shift where men and women should be accepted, just like we accept that both of these are important to reproduction. Then when infertility arises, then the problem should be shared equally between the men and the women. So it is important to bring awareness to couples that the treatment journey for infertility should be shared. It doesn't only affect the woman. The men can also be the cause, sometimes even the only cause of the infertility. So we know that about half of the causes of infertility include the male as the problem, either alone or in combination with some female factors as well. So just going through how does it come about for a man to have their fertility intact. So there is need to have the physical structures of the reproductive system, that is the anatomical structures. The physiological system should also be intact. We are looking now at the function, and this includes the hormones. And also there is also environmental influences, as well as dietary and lifestyle factors. So now, if there are any defects in any of these, then the man can also have problems with infertility. So some of the problems in the physical defects include congenital problems, where there is a problem, either they don't have the structures well developed, or they have been blockage that is born with, or it could be something that this has been acquired during the lifetime. And some of these acquired defects include blockage of the systems that transport the sperms from the testes to the time that ejaculation takes place. And on the physiological systems, then it's to do with hormones. So if there's any defect in the hormone system, then this also can impair the reproductive capacity of a man. Environmental factors like excessive temperatures, radiation, some medication, alcohol, as well as industrial toxins. All these can impair the sperm production, and so result into low sperm count or abnormal sperms that then will not be able to do fertilization. Just like with the women, dietary and lifestyle issues are also a very big contributor to impaired fertility in men. So we need to look at strategies to keep men healthy, and so that their fertility is maximized. So just like with the women, alcohol and illicit drugs, smoking, all these do result into impaired fertility. And so men also should make sure that they limit their alcohol intake, they stop smoking, and avoid illicit drugs. Remember, fertility is a shared responsibility, and so the treatment journey should be walked together. High temperatures can affect sperm production and motility. So things like sauna baths, steam baths should be minimized, and instead men should be encouraged to use showers, and also clothing, wearing loose clothes is very important, especially the pants, because then this will help to reduce the temperature that the testes are exposed to. Exercise, I think I've already said this, but you can never say enough about exercise. So exercise, exercise, exercise. And just like with the women, this should be done in moderation. And environmental toxins such as paints and other pollutants, these, as much as possible, should be avoided. Eating a balanced diet and maintaining a healthy weight, pretty much the same mechanism as it was with the women. So men should be advised the same way. So having gone through this far, there are a few key take-home messages that I would like to close up with. So let's remember that infertility should not be a stigma. Men and women are affected by infertility equally, and so then these people should get informed, such that when the infertility problem comes in a couple, then women should be supported. Men as well should be supported, because sometimes it is the woman that has the problem, sometimes it is the man, but sometimes it could be both. So couples should learn to, should be encouraged to support one another through the fertility seeking journey. As we know, this is a shared responsibility. We can never say it enough that it takes a man and a woman to have a child. It's not only the woman's responsibility. And more importantly, let us remember that men are more than fathers and women are more than mothers. And so they should be treated as full human beings, not less than human beings, simply because they are suffering from infertility. So as Merck Foundation, More Than a Mother program, we really strive to break the stigma around infertility in Africa. And so we say men too can be affected. They are key to the process of seeking care for infertility. We want to say no to infertility stigma, to create a cultural shift, and to break the stigma. We know men can suffer social pressure as well due to infertility, and they can also be the cause of infertility. Therefore, they can also suffer the infertility stigma. So we need to focus both on the men and on the women. Yes, men are more than a mother. Men are more than fathers, and women are more than mothers. And together, we can create a cultural shift to a world where there's no stigma around infertility in Africa. I thank you very much for your attention. That's the end of this presentation.
Thank you so much, Dr. Martha. That was really meaningful. I hope all our attendees, the journalists that are attending, will be, through their stories, breaking the stigma around infertility and helping their communities. Thank you so much, Dr. Martha, once again. We now move on to our next speaker, Dr. Godwin, who will be speaking about the psychological effect of issues which are there in our society, like infertility stigma, gender-based violence, FGM, child marriage. So I welcome Dr. Godwin. I would just like to introduce Dr. Godwin Dr. Godwin Matinhure is the medical doctor at St. Mary's Hospital, Ministry of Health and Social Services at Namibia. He's also the alumni of Merck Foundation. Welcome, Dr. Godwin. I request you to please start your presentation. Thank you so much. And also he will be speaking about that how media can create a community sympathy and how they can write inspiring stories. Over to you, Dr. Godwin.
Thank you very much. I've been introduced. My name is Godwin Matinhure. I'm based in Rehoboth in Namibia, and I will start my presentation. So the presentation is mostly to help the media to have an influence on how infertility stigma and social and other social issues like gender-based violence, child marriages, and female genital mutilation in women and couples can be reduced. The stigma can be reduced. So in terms of Merck has created this platform for us to have the media to discuss these issues, to emphasize on the important roles that the media plays to influence our societies, so that we can create a cultural shift that will aim at breaking these stigmas for infertility, supporting girl education, women empowerment, ending child marriages, and so forth. So basically, that's the main reason for this presentation. So this is the outline of what we are going to discuss. Briefly, some of the issues have already been touched on by the previous speaker, particularly on infertility. So child marriages, gender-based violence, female genital mutilations, and then I'll also speak a little bit on the Namibian fight, the role of media representation, the representatives, and then we'll conclude. So basically, a lot of these issues that we are going to discuss, they are in some instances regional, and some of them are pretty much global, but some of them are regional. So you find like genital mutilation occurs in certain parts of Africa, and then in also certain parts of Asia. And so basically, it's just to conscientize and for us to be able to know what are the definitions, where do we usually find these things, discuss about what are the drivers and the consequences of most of the issues that we are going to be discussing. So child marriage, by definition, is formal or informal union of a girl child before the age of 18. And it also, not just the girl child, but also to the boy child. When I prepared these slides, it was specifically for the girl child, but even for the boy child before the age of 18. It's a global issue with over 650 million girls and women being married before the age of 18. A third of the girls in the developing countries are married before the age of 18, and a fifth of girls before the age of 15. So locally in Namibia, through information from the Ministry of Gender, Equality, Poverty, Eradication, and Social Welfare, we have noted that the prevalence of child marriage in Namibia is at around 18.4% for girls and 4.1% for boys. And girls have got a sexual debut, which is anything between the ages of 12 to 17, and at the earliest being 11. I actually did my research when I was doing my MSc Psychiatry on early sexual debut and the impact that it has on the child, particularly to suicidal behavior. So it's quite a very important aspect that we need to look at, because child marriage and early sexual debut are interlinked. So the drivers for child marriages are poverty, cultural, traditional, and then the consequences obviously are psychological and social issues, where you can also have gender-based violence, and then poor educational attainment, poor sexual and reproductive health outcomes as a result of that early child marriage that would have happened. You have got this young child who's now married to somebody, and then they have to go through a pregnancy, and then they are more prone to complications, depression, anxiety, loss of the self-esteem. So these are not just individual consequences that one could have, but they are also, they affect the whole system nationally, globally, because they become a roadblock to global health and development, and also to the aims of gender equality that are being put forward in the world. And they also hamper on sustainable development goals, particularly number 5 and target 3 for the 2030, to eliminate all harmful practices, including child and early and forced marriages and genital mutilation. So I'm going to speak briefly about gender-based violence as well, which is harmful acts directed at an individual based on their gender. So they can be sexual, physical, mental, economic, threats of violence, coercions, manipulations, intimate partner violence. There are so many of them. And knowledge of all of these things will help when somebody is preparing a paper to write, so that you can have a better influence on what you are writing about. And these things, they are quite common, and they happen very frequently within our communities. The statistics show that a third of women experience sexual and physical violence in their lifetime, which is quite a huge risk. About 33% of people, of women, go through this. And it can happen to anyone, women, girls, men, and boys. The local statistics we have in Namibia is that Namibia is ranked 16th in 145 countries. In 2015 was ranked 16th, with an average of 33% of married women between the ages of 15 and 49 experiencing gender-based violence. Adolescents also between the ages of 15 and 19. So these are huge numbers that we are talking about. And obviously the drivers are still the same: the social, cultural norms, acceptability of gender-based violence, on the sense of it being a disciplinary measure, whether within a marriage setting, or whether within a family setting, or whether within even a work environment. So these things, they keep on cropping up, and we need to be sensitive to look into them. Poverty and culture, these are drivers. Tradition, early sexual debuts, as well as we have discussed already on child marriages, that once these early sexual debuts happen as a result of marriage, or just as a result of it just happening, you tend to get also abusive relationships. coming out of that. So the consequences are also biopsychosocial, so basically biological problems that you can get, medical illnesses and all of those things, injuries, head traumas that happened as a result. And there was a point in Namibia, it was really quite bad, and the violence was quite fatal in quite a good number of instances, which actually resulted in the government and the ministry really pushing forward more into the issues of gender-based violence. Sorry. So female genital mutilation, this is more in the western and eastern and northern eastern regions of Africa, and in some parts of Asia, in the Middle East, where female genital mutilation is still happening. So this is by definition all procedures that involve partial or total removal of the female external genitalia or other injury to the female genital organs for non-medical reasons. This is as a definition of the 2023 WHO guidelines. And WHO stipulates strongly against medicalized female genital mutilations, because in these communities as well, in a way, people thought maybe if these things are actually done within hospital settings, they become much safer. But the consequences are still the same, whether it is done in a hospital setting or whether it is done outside. So the consequences are still huge. These confidence issues, there's bleeding during the operations. Women tend to get a lot of urinary problems. After that, they get infections. It tends on their mental health as well. Basically, some of these things are happening to younger children or younger girls, and this basically violates their rights to physical integrity, their rights to, just being able to explore themselves at appropriate times. So it's quite common in these regions that we spoke about. Over 200 million girls and women have undergone this, and affected are girls between the infancy and 15 years. So it's quite prevalent. So speaking on infertility, I think a lot of it has already been covered, that who is affected and how they are affected, the causes. Basically, drivers are between male and female have been discussed extensively. So I'm not going to dwell so much on it. I'm just going to maybe highlight a little bit on the slide with a picture where it says regional infertility prevalence estimates. As you can look at it, my particular interest will be mostly in Africa, because we are in Africa, and how it looks within the WHO African regions. You'll find that the period of infertility prevalence is much higher than the lifetime infertility prevalences. My understanding is probably that there is a lot of preventable issues that are happening within the African setting, making the periodic infertility much larger than the lifetime. Because for the lifetime, you are expecting these things to be more genetic, more uncontrollable, non-reversible issues. As you can see with the other regions, you'll find that the lifetime is much higher than the periodic infertility, because of also a lot more interventions probably happening within these other regions than in Africa. So we need to kind of look at it and introspect on how we can actually be able to, be in sync with the region and look at these things and bring them up and discuss them and bring interventions to Africa. So the consequences, basically individual and couples, is discussed already. the costs of all of these issues pertaining to subfertility are quite huge. And in people who are trying to get artificial inseminations and all of these other interventions, but basically most of the causes of these things could be preventable. So locally in Namibia, there has been the creation of the Ministry of Gender and Equality, Poverty Eradication and Social Welfare Ministry, to try and also address a lot of these child marriage issues, gender-based violence issues, with the aim to address infertility and related matters regarding critical components of promoting sexual and reproductive health and rights. So it's quite a coordinated multifactorial task forces that the government has created, including civil society organizations and other partner bases to, come up with legislation and policies that actually help to reduce and combat these social ills that we experience. So there has been a response within the Namibian community that has come up. And for the media, this is stuff that they are continuously bringing up, to discuss these things, to write about them, and then promote a good health seeking and health promoting behaviors, encouraging prevention and early detection and treatment of a lot of these issues. Then also strengthening environmental and community mobilization strategies to fight these issues. So towards the end of my presentation now, I just want to speak about the role of the media, why the role of media is so important. Both the mainstream media, which is there now, the mainstream media has the role of correcting and channeling the truth. Other than just writing a good story for the thrill of it, it has to be, it should not overshadow the truth that underlines the issue that the author is writing about. Let the authors write based on what are they questioning, what are they deducing, what are they highlighting, comparative issues within or outside communities to improve policies and enlighten the public on relevant social and behavioral problems that we get. So, so there is need for media to have support and to inform the communities about the available policies and structures and strategies that are there. So the world has become a global community at the moment, and the current space of media is now rooted so much into the technology. Technology has expanded so much, and through the modern day, and we have got radios, television, cell phones. Everybody actually has got access to a device and be able to access more information. And now with the advent of social media, which has created a huge global village, howbeit with its own advantages and disadvantages, essentially, because there's a lot of misinformation out there. And it is the role of the mainstream media to actually channel those things and actually bring out the truths into issues. So other than just the normal sensationalization that happens outside, we need all of this misinformation to be catered for. Everyone has become a content creator, and these are very dangerous issues. Excessive use of social media also has got its own issues. So all that information needs to be brought out so that when these important issues that we've been discussing now are being brought up, then the communities or the people are even more receptive to accept them. So when you are writing, so as media, when we are writing, we need to be writing things that are relatable, things that are significant, things that show success and success stories, positive themes on the psychosocial, cognitive, religious, and economic impacts that you you are looking at. So the themes need to be very positive, focused on educating or exposing, reporting the news, current affairs, and transforming. And also some of them are celebrating information of the good things that are coming out and bringing out these issues back to the communities for us to create a cultural shift of understanding what exactly is happening, having a balanced reporting narrative as well. So what one be educating about, you can be educating anything about where the reporting centers are for gender-based violence, where the safe areas are, policies which the governments are bringing out, and so that you can conscientize the populace, bringing debates and discussions, bringing out relevant cinematography and theaters and arts, and basically exposing as well, giving a voice, a platform to things that are probably sometimes taken back and not looked into. The reporting should be very accurate and very prevalent, with information which is very relevant to the authorities, and that identify issues in a balanced reporting manner. Should be very unbiased, preventing cover-ups, not influenced, not biased, not influenced by external issues, whether to report positively or negatively for other benefits outside what we intend the media to do. So in conclusion, these situations, child marriages, gender-based violence, female genital mutilation, infertility, these issues are all intertwined. When you have somebody with infertility as a result of an infection, with somebody who has early sexual debut as a result of early marriage, and had a lot of infections throughout because the age of initiation of sex was so young, so then they get infections, and then they don't get pregnant, or all sorts of things. And some of them are preventable or avoidable. So they cause a significant trauma to individuals, and we need to be able to look and write sensitively so that we can bring that cultural sense change within our communities. They are global health burden. The social and psychological impact of these ills are significant, and they need to be addressed from individual to community and to a global scale. Media in all forms can be harnessed to a positive impact when it comes to these issues. I thank you.
Thank you so much, Dr. Godwin. You made some really relevant points there. In today's world, when we have so many content creators, everybody is trying to be a content creator. So it is on the media to take the right information to the communities now. Thank you so much once again. And before I invite our next speaker, I would like to invite you all to watch the first animation film by Merck Foundation, Sugar-Free Jude, released with the aim to fight diabetes and raise awareness about its prevention and early detection. And also to promote healthy lifestyle amongst the children and youth in Africa and beyond. Can we have the film, please?
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes.
It's morning rush time to school, and Jude is about to take a big bite into his breakfast on the go. Jude loves donuts, especially sugar-coated ones.
I love the taste of sugar on my donuts. It makes my morning sweet with this juice combination.
Jude, don't you think your eating habits are too unhealthy? I am worried about the rate at which you consume sugar products.
James, relax. I can't wait to eat my lunch. More donuts? There's nothing to worry about.
Jude was not bothered about James' concern. He went on eating more sweet foods day after day. As the days passed by, Jude started noticing something quite unusual.
My goodness, not again.
Jude would wake up several times at night to wee wee. It was so uncomfortable. Not only that, but he also noticed that he would wake up very thirsty. Jude would need to drink water multiple times during the day as well as night, and this also meant using the washroom several times.
Oh my god, this is so destructive and shameful.
What is it? This appears to be the third time you woke up to use the bathroom. You even look a bit fat. Very unusual.
I have no idea, ma'am. And I've been feeling very thirsty lately as well. And sometimes tired.
We need to see the doctor to make sure all is well with you.
I agree, ma'am. It disrupts my day at school too much.
At the clinic, Dr. Yobo decides to conduct a few tests to confirm his diagnosis about Jude. He opts to do the blood glucose test to check Jude's blood sugar level.
So according to the results, you have type 2 diabetes.
Type 2 what?
Diabetes is a condition wherein the blood sugar level in your body becomes too high. In type 2 diabetes, there is insulin resistance or relative deficiency of insulin that result in excessive blood sugar, which in turn can lead to other health problems. In short, type 2 diabetes is a metabolic condition in which the body's insulin is either ineffective or relatively insufficient to deal with the blood glucose levels.
Dr. Yobo continued to explain to Jude about his condition.
The exact cause of diabetes is not known, but genetics, family history of diabetes, and an unhealthy lifestyle seems to be the most common and important causative factors.
What happens if diabetes is not well controlled?
The long-term complications of diabetes can include the following: stroke, blindness, heart disease, kidney failure, sexual dysfunction, and amputation. Type 2 diabetes is a chronic condition in which there is bodily resistance to the insulin produced by the pancreas, and it typically manifests in adolescents. Managing this will require medication and regular blood sugar tests as well as a healthy lifestyle.
It was tough to accept for Jude at the beginning.
My days of sugar-coated donuts and sweetened drinks are over.
But he had support for his new lifestyle. The school made sure his lunch was not full of the usual sweet things, and his friends reminded him to take his sugar test and play football or basketball with them regularly to keep healthy. His parents were also supportive, preparing healthy meals for him and removing all sweet and sugary drinks from the house. In fact, all family members became sugar-free too. Back in school, Jude and his friends soon formed a Sugar Police Kids Club to raise awareness about the condition and to help others who had diabetes or were pre-diabetic so they can prevent and early diagnose it.
Try to go sugar-free in your meals. Eat more fruits and veggies, along with moderate daily exercise. Our lives can be so sweet without sugar too. Let's all work together to fight diabetes every day.
Merck Foundation. No more diabetes.
All right, so I hope this short film by Merck Foundation, you found it very interesting and insightful. The next speaker that we have is also going to be giving us more information about the same topic and also about hypertension. So I now invite Dr. Ronald Liu, the Chief Medical Officer at Greater Francistown District Health Management Team of Botswana. Welcome, Doctor.
Thank you very much for the introduction. My name is Dr. Ronald Luke in Francistown, Botswana here. So I will be talking about the promoting a healthy lifestyle and raising awareness about prevention and early detection of diabetes and how media can help us with that, with the health promotion. Okay, there you go. So We are going to discuss promoting healthy. No, I have issues with my internet, I think. It's lagging behind. The slides are lagging behind.
Do you want us to help you? Do you want us to do the navigation? You can prompt and Bhavesh from my team can navigate your slides.
Okay, no, let me
try again. Okay.
Let's wait and see. Thank you. There you no. Sorry about that. So, promoting a healthy lifestyle and raising awareness about prevention and detection of diabetes and hypertension. Something is not right. How to report about it to the community? Like this where they. No, can you help me like navigating the slides, please?
Sure.
Hello?
Yes.
Yeah.
You can just prompt for next and then he will move to the next one. We'll go to your first slide.
Yes.
Or maybe
Thank
the
you.
second one after the introduction. Yes. Bhavesh, please go to the next slide, please. But yes, let's start from here.
Yes, that's one. So I will be talking about diabetes and hypertension and how the media can help us report about it to the community. As you know, like diabetes and hypertension are two examples of non-chronic and non-diseases that transmitted between people. With different kinds of many non-communicable diseases, including cardiovascular disease, like I said, cancer, chronic diseases such as we heard about it earlier this.
Dr. Liu, we cannot hear you. Can you reconnect, please?
Maybe I should.
Yeah, Dr. Liu, let's try without the video because I think video is eating the bandwidth. I'll stop the video for a
Yes.
while. Yeah, you did it. Now let's.
Okay.
And yeah, it is clear now. Let's do it quickly. Yeah.
Thank you. So non-communicable diseases such as cardiovascular disease, diabetes, cancer, and chronic respiratory disease. I gave an example like asthma and COPD, and also infertility, like we heard earlier, is an example of non-communicable disease. The non-communicable diseases result from a combination of genetics, physiological, environmental, and behavioral factors. All those things, some can be modified, some cannot be modified. Like genetics, there's nothing to do about it. Physiologically, we can't do anything. Environmental and behavioral factors, that's where we can do something about it to prevent non-communicable diseases. Non-communicable diseases are the leading cause of death and represent an emerging global health threat. Like we have diabetes and hypertension and heart failure and heart attacks. All those are the leading cause of death worldwide, and cancer. Next slide. So this is the list of non-communicable diseases. High blood, that's hypertension, diabetes, and heart disease like heart failure or heart attack and angina, and others. We have a stroke, we have chronic respiratory disease and cancer. This is just the repetitive of the previous slide. So these are non-communicable diseases. For the media to report about them, they should know them. Next slide. Next. So let's have a brief talk about diabetes. It is a chronic metabolic disease characterized by elevated blood sugar, which over time leads to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. We have seen this in June's video. Like the previous video we have seen all this, the definition of diabetes and the complications it can cause. And the symptoms, we have seen them: excessive thirst, like dry mouth, excessive appetite, hungry all the time, and they're going to the toilet most of the time. And with that, because it's a metabolic disease, you have weight loss because you can't keep nutrients in your body, and you have vision changes. You might lose sight because of the damage to the small vessels of the eyes, and you are always fatigued because you don't have the glucose that will provide you with energy. Next slide. So this is a poster from IDF. These are some of the things that can be posted like around the community so that they are aware what diabetes is and how they can identify it early and they get tested and they get treatment early. The following may mean you have diabetes. So you take this poster, you put it in a school or in a community place. It might help early detection and early intervention, which might help some patients. Excessive thirst, like I said, slow healing of the wounds, and constant hunger, excessive tiredness and drowsiness, tingling feet, and in the feet, tingling feet and hands due to peripheral neuropathy, damage to the nerves, and sudden weight loss and unexpected weight loss can all be signs of diabetes. Next slide. So there are several types of diabetes mellitus. These are the three common ones, like a type 1, type 2, and gestational. Usually type 1 start at early, like in children, you expect them to have type 1. But now because of obesity and all that, we see children with type 2 diabetes. Type 2 usually starts late from 40s upwards, but because of the new lifestyle, we see young people having type 2 diabetes. And gestational diabetes is pregnancy related. It's the diabetes that is detected while someone is pregnant. Next slide. So these are the risk factors for diabetes. If a family member has diabetes, one is likely to have diabetes. Usually the siblings and the parents of that person, if they have diabetes, the person is really at high risk of having the disease. And if you are 45 plus, also you are likely to have type 2 diabetes. You are at risk, higher risk of having type 2 diabetes compared to if you are below this age. And ethnicity, if you come from Africa, like blacks, they are more likely to have type 2 diabetes compared to the Caucasians, mainly because of the genes. And the physical inactivity, if you don't exercise, you are at higher risk of having diabetes. Then body weight, overweight or obese puts you at risk of having diabetes, because all these are metabolic related conditions. Then high blood pressure, if you have high blood pressure, there's a link between diabetes and high blood pressure. Like if you have high blood pressure, you're likely to get diabetes because of the damage to the lumen of arteries, of blood vessels. And high cholesterol also, insulin resistance. It promotes insulin resistance, which is which will eventually turn into diabetes. Smoking also is a risk factor for several non-communicable illnesses. Next slide. Another poster from IDF, which can be distributed in community halls, at schools, at hospitals, for patient education, diabetes complications. So if you have diabetes, you are likely to have complications, several complications, like we mentioned, it was mentioned in the video. You are likely to have stroke because of issue with the blood vessels. Diabetes affect the lumens of the blood vessels, so they become narrow, they become sclerotic, and eventually they might give a plaque that will cause a stroke. Then blindness, like the eyes, there's likely damage to the small vessels of the eyes, causing blindness due to diabetes. Then heart disease, like heart attack and angina and chronic cardiac failure. You are all at risk of having these conditions if you have diabetes. And kidney failure. If you have diabetes, because of the mechanism involved with the kidneys filtering glucose, but if there is no filtration, if there's no filtration, then you have like toxins in the body that will cause your kidneys to fail. And the sexual dysfunction, it was well described earlier for both men and women. If you have diabetes, you are most likely to have sexual dysfunction. Then, because you have a poor healing wound in your feet due to poor circulation and due to poor circulation, you are more likely to be amputated as a complication of diabetes. So you can see there are serious complications of diabetes. The community should know about them so that they somehow prevent them. They should know about the condition and method how to prevent them. Next slide. Nutrition. Because it's a metabolic disease, nutrition plays a role in management of diabetes. So here, it's an example of what should be eaten often and what should be limited. In the green box, you have it's what you have to eat often, like oil-based salad, like all the tree oils are considered safe to consume often. Then in the red, what you should limit are mostly the animal fats. Those you should limit because they promote development of diabetes and other non-communicable diseases. Sometimes you can eat low-fat creamy salad dressing like light range, oils, corn, soya bean, sunflower. You still see sometimes you can eat plant-based oils, but the animal oil you should avoid by all means to prevent you getting diabetes. So nutrition is very important. Like the community should know about this, like so that they have informed information about diabetes, about how to prevent the diabetes through nutrition or how to manage it, so that they don't get those complications I talked about earlier. Next slide. Prevention. How can we prevent diabetes? For type 1, it's difficult to prevent, but for type 2, we can do something about it. Like you maintain your healthy body weight. Remember, I said obesity and overweight is a risk for diabetes. So if you maintain a healthy body weight through being physically active, through taking healthy diet, you can prevent diabetes or delay its onset. Then avoid tobacco use. By all means, we should stop smoking. We should avoid using tobacco products because they have bad consequences. So prevention. This also can be like a message from media to the public on it's on how to prevent this condition, diabetes. Next slide. That was about diabetes. Now we talk about hypertension, the so-called silent killer. This is the definition. Hypertension is diagnosed if when measured on 2 different days, systolic blood pressure more than or equals to 140 and diastolic more than or equals to 90 millimoles of mercury on both days. 2 different days you measure and the blood pressure is like this, then someone can be diagnosed with hypertension. It's a condition in which blood vessels has persistently raised blood pressure. 2 more days, you have hypertension. If systolic is more than 140 and diastolic more than 120. Condition of the blood vessels. And hypertension is the leading risk factor for cardiovascular diseases. If you have hypertension, you are more likely to have all these cardiovascular diseases like stroke and heart attack. So it is a very important silent killer. It kills because people won't realize they have it unless they measure it. They take readings. Next slide. Next. So the risk factors for hypertension, we have modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are the ones which lifestyle can, the modifiable ones are the one which lifestyle changes can attack. So unhealthy diet, if you've been having unhealthy diet, you can now get a healthy diet, the one with in the green box in my previous slides there, like plant-based oils, plenty of fruits and vegetables, less animal meat and salt. So you modify your lifestyle. Physical inactivity, if you are because inactivity by itself it's a risk factor for hypertension. If you get active, you can prevent getting hypertension. So it is recommended that we exercise every day, or if not every day, at least 3 times a day, 30 minutes per session of moderate to intensive exercise. Consumption of tobacco and alcohol we have to, if someone is taking alcohol or tobacco, they have to stop them to prevent getting hypertension. And being overweight, you exercise, you eat healthy meals, then you will control weight. Then your risk of getting hypertension will be minimal. Then the non-modifiable risk factors, this ones, it's unfortunate there is nothing one can do about them. If you have a family history of hypertension, like your mother, your father, and your siblings, they have hypertension, there's likelihood that you too will develop hypertension. If you are more than 65 years old, you are likely to have a hypertension compared to when you are young. And coexisting diseases such as diabetes or kidney disease. These diseases, they go hand in hand because some of the mechanisms they present are similar. Next slide. Symptoms. Why is it called a silent killer? Because a person with high blood pressure usually doesn't have symptoms. You will see someone walking around laughing with you, healthy looking, playing, drinking, socializing, reasoning, going to work, but they have hypertension. Unless they check it, they wouldn't know they have hypertension. So because it's asymptomatic. So the only way to know that you have high blood pressure is to measure it. Measure high blood pressure. This is very important because now that's where the media comes in. They have to take the message to the community that they must encourage the culture of going to health facilities to do screenings for these non-communicable diseases. But sometimes symptoms do okay. So you might have early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. If someone has these symptoms persisting, then it is advised to go and check blood pressure, to measure blood pressure. Then sometimes we have hypertension, severe hypertension, which could be an emergency because it could be telling us that some organs are being damaged because of hypertension. You are fatigued, you are nausea, you have vomiting, confusion, anxiety, chest pain, and muscle tremors. So this can mean now some of the important organs are being damaged by hypertension. So it's a medical emergency, severe hypertension. Usually they define it as systolic of more than 180 over diastolic of more than 110 millimoles of mercury, millimeters of mercury. Next, complications. Just like diabetes, the blood vessels are affected in these conditions. So on the left there, you can see like the normal blood vessel, the lumen is big, and the blood cells are flowing normally there. Then on the left side, yeah, on the left side is the normal one. On the right side, the lumen has been reduced because of stiffening of the blood vessel by hypertension, by all the blood pressure always high, then these changes in the blood vessel anatomy. So if you have this, then you are likely to have stroke if you have hypertension, because now as time goes on and you have high, let's say you have a high cholesterol, the narrowed lumen can develop atherosclerotic plaque. And when the plaque ruptures, it can cause a blockage into the brain, causing stroke. Or sometimes the blood pressure is too high and it can rupture some of the small vessels in the brain, causing hemorrhagic stroke. So heart attack, same mechanism. Sometimes it's blockage of the blood vessels supplying the heart muscles. Then you have heart attack because there won't be any oxygen going to the heart muscles. Same with the kidneys. High blood pressure affect the kidney vessels. Lack of oxygen to the kidneys causes renal failure over time. So you can see complications of hypertension are the same as identical as complication of diabetes. So if you target one like exercise, in diabetes we said exercise, eat healthy, stop smoking. So if you do those things, then you'll be killing. If you do those things and you have hypertension, then you'll be killing two birds with one stone. Next slide. Prevention. Hypertension can be prevented by targeting the risk factors that I talked about earlier. You reduce salt intake to less than 5 grams per day, and you eat fruits and vegetables regularly. You avoid saturated and trans fats. You avoid saturated and trans fats, and you try to, by all means, to increase plant-based oils instead of fat, animal-based or instead of animal-based fats. You avoid smoking and you reduce alcohol. Then you be physically active every day. So these things, you do them, you avoid, you can prevent hypertension. You do them, you can prevent diabetes, like was mentioned earlier. Next slide. So high blood pressure, you can control it. If you have your high blood pressure now, you've been diagnosed with high blood pressure, you can control it. Like you can live a normal life because you are controlling high blood pressure. You are reducing your risk of getting complications from high blood pressure. So how do you do it? You follow medical advice and you adhere to your treatment, to your lifestyle changes and treatment. You take your medication all the time as prescribed by the doctor. And regular checkups can help you to see the pattern and also, and you encourage you to do like lifestyle changes. If you still see the blood pressure is high, you have to check on your diet, you have to check on your exercising routine. Then the doctor can check and adjust the doses of medication. You engaging in activities that makes you happy, talk to friends or doing yoga and medication and meditation and other things. Next slide.
Luke, a polite reminder on the timings, please.
Is it time?
Yes, please. You may conclude now because this is your second last slide. Yes.
This is my second. Thank you. The role of media. How can media help with dispatching information to a larger community? The mass media provides an important link between the rural resident and the vital health information. So because media can reach like even far places to reach physically, they can help link this with the health, those people with health information. It also helps workers to expand their audience. Like I said, like now we are here in this talk, so the media from here, they can go out there and tell the world what we have been doing. And they play a major role in educating the public about health concerns. That one is straightforward. And they have responsibility to report accurate health science and science information to the public. This was said earlier by the other speaker. And media can play a supplementary role by being integrated into a program that includes face-to-face or other forms of intervention. Next. So lastly, the media can be used at many levels of audience organization. Can be an individual, it can be a network, like people have social media, WhatsApp groups can be there to share information. It can be organizational, and it can be at a society level, like with the radios and TVs and newspapers. And health promotion, disease prevention. The goal is to enhance a state of well-being to guard healthy and population at risk. So media can also promote health issues, and by doing so, helping in disease prevention. And the goal will be to enhance a state of well-being to guard healthy and population at risk. They can go there and target the population that they want to disperse information to. Thank you very much.
Thank you so much, Dr. Liu. That the presentation was really very, very informative for us. That was the end of the sessions from our medical experts. Thank you so much. Please stick around so that if there are any queries after the session, you are there to help address them. Also, we have a few questions in the Q&A section. If you can please address, Dr. Martha, maybe you can please address those questions. And now I invite our first media expert speaker, Mr. Moses Kofa, our long-term partner, also the Executive Director of Media Council of Malawi. Thank you so much, Mr. Moses, for joining us today. And you will be speaking to our audience about the role of media in reaching out to the communities at grassroots level and raising awareness on all the health and social issues that we are addressing today. Welcome, Mr. Moses.
Thank you very much, and good morning, everyone. I've been given about 10 minutes to talk about the role of the media in reaching out to communities at grassroots level and raising awareness on social issues. It's important actually to note that issues of health, especially human health, are actually not very strange to media practitioners, because most of us must have first-hand experience. The likelihood of us engaging in the behaviors that our health experts have actually highlighted is very high. And I know that most of us probably would definitely be engaged in reproductive health issues. Some of us are married, have been through those kinds of experiences. Our brothers and sisters might have been through those kinds of experiences. And some of the media practitioners probably are not yet married, they are yet to get married, and they will go through the same experiences. And they still have some extended family members who have gone through those kinds of experience. So it's something that really still touches on our personal lives. So my discussion today is actually focusing very much on trying to highlight the critical role that journalists play in addressing infertility and other sensitive social and health issues. But also we are going to look at the best practices for reporting that align with international standards and also ethical considerations. I've noted that a number of roles of the media have been highlighted by our health experts that have presented before, but just to emphasize that as media practitioners, we have a very big role to break the silence. We are living with the people affected. We are living with the behaviors that need to be changed, and we are living within the same communities where stereotypes and the other abuses are taking place. So we need to be in the forefront, breaking the silence. Let's open up. Let's open these conversations. Let people discuss these kinds of issues. Let us create a platform, provide a platform for our communities to begin to discuss these issues. We are the voice of the voiceless, and our role very much is also to make sure that we highlight personal stories that resonate with audiences and empower individuals facing infertility, thereby promoting empathy and understanding of these particular issues. There are people who are affected who probably do not know what to do, who have in the communities they live in. We can still speak for them. We can create platforms for them now to speak about their personal experiences, the painful moments that they're experiencing, and probably even testimonies of what they have done to get out of the experiences or the kind of challenges that they have been experiencing with their health. And then we also have the cultural shift. In this era, we are looking at changes in our cultural beliefs, how we live, our lifestyles, and so on. We have lived to believe in most of our cultural setups that if discussions about infertility are a taboo, but today these are very important topics that needs communal support, communal understanding, and also probably we need to now begin to trigger that kind of action in the people in the communities. You know, we have community structures, the area development committees, where they also have health committees. We have the village development committees in the rural areas, where they are also having the health committees. We have the government health surveillance assistants. Let us bring them together. Let us engage them to create topics that we can discuss using our media platforms, and then probably create a change of perceptives and have a clear and positive direction in changing the mindset of the people and changing the decisions so that we need to make the world a better place. Best practices with regard to our media work. Firstly, we need to look at how best we can comply with the ethical standards, especially those that have been established by the Media Council of Malawi, alongside other international institutions like the International Federation of Journalists, UNESCO, and other relevant institutions. These will help us actually to ensure that we provide accurate information, we are being fair to the people that we are featuring in our stories, we respect the privacy and confidentiality of individuals that are being featured in our stories, those that have gone through the painful moments, that have been misunderstood, or sometimes that need to be supported in various ways. We also need to see how best we can use sensitive language, the choice of words that avoid perpetuating humiliation, and also trying to be neutral and compassionate in the language that we use to avoid exaggeration most of the times, because we want probably to sell our stories, to sell to make our media outlet more attractive. We try probably to exaggerate in the presentation of our information, to make it more attractive, and that actually compromises the quality of information that we are disseminating. And we also need to make sure that we incorporate diverse perspectives. Today, we have been lucky to be introduced to more experts that probably we can engage when we are compiling our stories. We need to look for advocates in the communities. We need to look for individuals that have been affected by issues, the infertility issues, the behaviors that lead to infertility, for example, the hypertension, the diabetes, and all those kinds of things. There are all those kinds of behaviors that our experts have actually shared with us. That can, if avoided, probably we can avoid diabetes, we can avoid hypertension, and eventually avoid infertility that would affect us in the which of our lives. So we need to incorporate all these kinds of voices, the individuals that have been affected and so on, and then avoid stereotypes. And, there are these kinds of groups of people, categories of people that have been traumatized. They have been rejected in their communities because they have faced or they have experienced these kinds of negative experiences, the issues of infertility in their communities. And if we also try to probably expand that kind of perception, definitely we are not doing justice to our communities. So we need to begin now to create a different narrative, a positive narrative that brings everyone together, so that together we make right decisions and find solutions to the problems that we face in our communities. Remember, I said that the likelihood that most of us, or even media practitioners, have been through these kinds of experiences is very high, probably 95% or so. And the likelihood that more of us are going to experience these kinds of traumatic experiences is also very high. So let us give it a human face and begin now to discuss, to create conversations around this with a human face, knowing that we are part and parcel of the issues that are happening in our communities. We have some international reporting standards that we also need to pay attention to. For example, when we are dealing with our sources, we need to make sure that we seek consent, taking pictures, conducting interviews. We need to make sure that these have permitted us to feature them in our stories. Where necessary, probably we can even have a documented kind of consent, allow them to sign somewhere, allowing us, permitting us to use their stories in our our media outlets, and also if we are if probably there is need for us to conceal their identity, we do that. If we probably don't need to use their pictures, we pay attention to that as well. So those are that is one of the issues we need to pay attention to. Accurate and contextual reporting, I've mentioned this at some point as well, but providing accurate information on these sensitive issues and social issues is very, very critical. Let us always be in the lookout to do our own research. And as I said earlier on, engaging experts will help us actually have credible information. Where people can access services, where people can access treatment, where people can meet with reputable medical professionals, the kinds of behaviors to be avoided, the kinds of behaviors to be promoted. All these particular information killing people because we have given them wrong information that eventually leads them to death. So we shouldn't be in that particular situation. We also need to focus very much on fact checking. These days we are being challenged we are in the era of technology. There's a lot of information being circulating on social media, and we also have some AI generated content, and sometimes we can just assume that this is the right information and publish it. We need to use all the mechanisms in place to fact check and verify the information that we come across, so that at the end of the day, we give people the right information and confirmed reports as we might have verified with our experts and the credible statistics, reliable sources. I also want to talk about a few strategies that we can use to raise awareness. Firstly, I want to talk about how we can create feature personal stories for our respective audiences. Create narratives that feature real-life experiences of individuals dealing with infertility, so that we build empathy within the community. If people get to know or hear about a life experience of the people that they are living with in their respective communities, it will create some kind of motivation for them to also come up in the open to share their experiences and probably seek solutions together with the others that have been through those particular experiences. Let us also create interactive platforms. Let us use the social media platforms positively. Let us create ICT interactive platforms that can help us actually engage in more discussions with our respective audiences. And then we also need to make sure that we use the community structures that I mentioned earlier on, the area development committees, the health committees in our communities. I'm thinking very much about the community radio stations, and these are the stations that are living together with the people in various communities where we live in. If we can use all these particular structures to engage communities or in these particular very important discussions, I believe that we can increase awareness. We can create awareness also of support networks and services available, and also demystify the taboos that we have always lived with in our cultural contexts. We have some overarching social issues. In this case, we are creating our stories. Let us link them with issues such as how we can support girls' education, educate women so that they can have a better understanding and access to reproductive health information, so that the behaviors that we have that have been mentioned by our experts leading to the problem that we are discussing today of infertility can be avoided in due course. So there are some of the behaviors that have been mentioned, propagated probably because of early marriages and all those kinds of issues. If we promote girl education, it means definitely these other behaviors can be avoided. We also need to look at how best women can be empowered. You know, addressing infertility can lead to more informed choices and empowerment. If we empower women to have alternative activities in the communities, definitely these other behaviors can be avoided. And as earlier on said by Dr. Martha, fathers are more than men are more than fathers, and women are also more than mothers. There is quite a lot that women can do, a lot that men can do, that eventually would lead to avoidance of these particular problems we are discussing today. Let us also link the issues of infertility with ending child marriage and other harmful practices. We discussed these particular behaviors, the early marriages, the harmful practices. Definitely, if linked to issues of infertility, can lead to a changed behaviors and also better lifestyles in the communities that we live. So in conclusion, I want to emphasize that complying with ethical reporting standards is very critical in addressing the issue of infertility and raising awareness. And journalists really play an essential role in influencing cultural shifts by effectively sharing stories and opening dialogues. Media practitioners need to commit to ethical, sensitive reporting to advocate for the voiceless and contribute to a healthier discourse surrounding infertility and associated issues. Otherwise, I thank you so much for listening and wishing you well. Thank you.
Thank you so much, Mr. Moses. You really made some very relevant points, and it is very appropriate to say that infertility as a stigma is overarching with many other social issues. Thank you again. With that thought, I want to invite my next speaker, which is also a media expert from Botswana, Ms. Jeannie Olsise, senior journalist from Yarunama FM, Botswana, to share with us that how can media be a creative and a honest tool to address our sensitive and critical social and health issues on a daily basis. Welcome, Ms. Jeannie.
Good morning.
Very good morning to you. Thank you so much for
joining us.
Thank
you for the opportunity. It's always difficult when you come after other speakers and most of the subject matter has been covered, but I will try to be a little nuanced. Perhaps I should take it from stigma because here we were looking at infertility as being stigmatized and how the media can play a role, a creative and honest tool to address sensitive and critical social health issues on a daily basis. So I'm just going to start by stigma. Using the social constructivist perspective in cultural studies, that all knowledge is historically and culturally specific, we must extend our inquiries beyond the individual into the social for a proper understanding of social life. Now, stigma, I'm going to use, because it's a difficult concept to define, I'm going to use the constructivist perspective, where Goffman says stigma is socially constructed and socially embedded. It is present when elements of labeling, stereotyping, separation, status loss, and discrimination co-occur in a power situation that allows components of the stigma to unfold. Now, why is this important? We are looking at this because we're looking at health reporting in general and the stigma associated with it. I'm going to say associated with health reporting because the issues that we are raising here include infertility, include diabetes or non-communicable diseases, both of which have some sort of stigma. Now, Deacon et al. Define disease stigma as an ideology that claims people with a specific disease are different from normal society, more than just from the disease that they're going through or the infection that they have. So why is this important in our discourse right now? It's important because the media is not just an information source. Like we are saying here, the media can help in ways of informing the people, letting people know about the health issues, but they are also part of a society. They are part of the culture. So they have the power to assign meaning. What is acceptable socially, what is not acceptable. The media has the power to label certain groups or behaviors as negative or positive. And this requires power to assign meaning, which must then accepted as a society where this circulates. Now, this is important in a changing media environment. Today, we're seeing the advent of social media, where now the ways of communicating are faster, more immediate, and so forth. So media then must be careful on how it represents issues. The role of the press is that of communication, as we all know, and has been said by various presenters here. But it is important how it does this meaning making. The way it mediates this is through language. So customs, symbols, it has to be sensitive as to how it presents this information. For instance, in Botswana, it is easy to fall into the trap of patriarchy because patriarchy is still dominant in the country. And as such, women are seen as minors, first to their fathers, then to their husbands. You know, this is seen in normal everyday discourse when you ask, I don't know how to say this in English, meaning greeting. So how are you? They ask, how are the children, which includes the female who is the mother. So these little cultural nuances, they find their way in the representation within media texts. And the media must be sensitive when they do their reportage. Because if you, say, for example, go and cover an event where a chief is talking, and then he says, Abana banne careful, and then you just reflect that and you say you're being objective. You just reflect that as he said it, unaware of the cultural nuances that exist. Then, as a media practitioner, you're complicit in the stigma, in continuing the gender imbalances, which then continue the challenge that we're dealing with here of infertility stigma, of gender-based violence, of all sorts of health challenges that we're dealing with here, because they are embedded in the cultural text, which we as the media are guardians of. We also shape the subjectivities, you know, who gets to say what. When we write our stories, for example, do we blame the victims So I concur with the last speaker that the media must be sensitive in their presentation of text. They need to ensure proper research, to be culturally sensitive so that the messages can be received. If you are speaking about infertility in Botswana, you know that when a woman is considered infertile, you know she doesn't get to be called Masamama. She gets called by her first name, therefore remaining a child. She doesn't transcend. So when you write the story and you continue that writing in that way, yes, you will be received well, but you can be deliberate, intentional. For example, when you give your reportage that, no, iseng Masamamang, but rather Genie. That way you are moving away from the predominant discourse, but still reporting the issue of maybe infertility to say this person has a challenge of this health problem, which is culturally perceived as reducing the person to less than they would otherwise be. The media needs to be objective as far as possible. As I've said, sometimes objectivity is influenced by the subjectivities of where you are, the environment, where you are, what is socially accepted. Can you challenge what Khosi has said, for instance, or you try to reflect as adequately as possible what he said and therefore also be complicit in that kind of stigma. Media needs to balance their stories. This has been shared already. Allow a right of reply. If you are reporting about a sensitive health challenge, HIV, infertility, diabetes, you need to, when you are talking to people who are dealing with the issue, give them a right of reply. Engage the experts to enunciate the issues so that perhaps you can have a balanced piece. So yes, you can tell your story, but then also try and find the scientific basis of the issue, try to contextualize the stories, and then let the voices of the affected also come out clearly. You must also share the realities on the ground. This can be done easily with the advent of social media where you allow a feedback loop. So you write your story as you prepared it, but allow your story to be challenged, to be read differently, and allow for the feedback to inform your reportage going forward. The one other thing that perhaps is not usually spoken about is the silences that the media perpetuates. In Botswana, we have many health challenges, and among them there is high HIV prevalence, malnutrition, non-communicable diseases, inequalities in terms of access to healthcare, and then lately gender-based violence. Now, all of these issues, they contribute to infertility, as you have heard from previous speakers. They contribute then also to the challenge of stigma continuing, not going away. And as human beings, we try to mitigate the impact of anything bad. We want to associate it with the other. If it's bad, it's because these young people are doing it. It's because these young people have no self-control. It's because they are, engaging in early sex. They are not careful. We try and blame and marginalize the issue so that it's these people who cannot be controlled, these women of these days, who are unbridled, to marginalize the issue. So when you report, you need to be aware of some of these nuances and where all of these issues come together, the confluence of the health challenges and the stigma, where they come together, and then be careful to try and inform, create awareness on each of the issues and how the challenges can be avoided. For example, if the people are aware that they should eat well, exercise, then they can avoid diabetes, for instance, and then they can avoid infertility in the long term. Then maybe you don't have to deal with the other social issues which are ugly, because then people are well aware, they engage in good practices, and then they don't get the disease. So being aware of where the health challenges intersect with the stigma is helpful when you're aware of it in your reportage, and therefore when you pen your stories together, you are aware of the nuances and can enunciate them well. You need to avoid the silences. We, especially in Africa, we don't talk about sex openly. It's considered taboo. And issues of infertility, talk about sex openly. Issues of HIV force the discussion of sexuality into the open, which then sometimes make it difficult. And because of these things, we find that the media will not cover issues of sexuality in detail and maybe withhold necessary information to the affected, the very people that you are hoping to protect, the vulnerable, the young, the women, and the men. I mean, these days we are seeing a lot of sexual issues, prostate cancer on the rise, and some of these things can be helped, avoided by just information sharing. So the media can play a role in that regard. So you should avoid those silences which allow for then competing discourses, which then lead to misinformation to those very people that we're trying to assist. So for me, that is how the media can be used on a daily basis as a creative and honest tool. It can be used by one, being culturally sensitive, being part of the culture, helping to make meaning of the challenges that exist, and to give the proper information using the expert knowledge that exists. I believe, without going too much, unfortunately, I had put too much and I didn't prepare a slideshow for the team, but I hope I have covered the key issues. Thank you.
Thank you so much. You have any other points that you would want to share, Jeannie? Thank you so much, Ms. Jeannie. That was really wonderful. Despite all the points, many points being covered by the prior speakers, you still made a point there. And we really appreciate that. Thank you so much once again. And again, I would like to thank all our attendees. If you have any question for any of our speakers, please raise your hand on Zoom and we will allow you to please ask the questions. If anybody has any questions, or you can write to me on my WhatsApp number. I have shared the number in the Q&A section, and I will get you connected to the experts, because like I saw that many of you want to reach out to the experts. If you want access to the PPTs from the experts, again, please let me know. If you want to get connected to any doctors, experts for your stories, I will help you there as well, so you can get connected. Thank you once again to all our speakers for joining in today and giving us your precious time. And thank you for all our attendees. Thank you, everybody. Have a very good day. Bye-bye. Bhavesh, we can end the session now.
Sure.